I believe my voice, and anybody who's got cancer has a voice, is to tell people and explain to people what they are going through.
People who are actually genuinely going through this experience are getting a chance to step forward and say, these are my experiences, and we can take that information and learn from it and improve services in the future, and that's what it's all about.
I suppose it's not every day you're told you've got cancer, and it is difficult to deal with, because you don't kind of know if you're going to survive it. You just know it's going to be a rough road.
I think there's an awful lot of input at the beginning. You go to your GP, then you're referred to the hospital. You've got specialist nurses, Macmillan nurses, clinic nurses, surgeons, everybody taking a huge interest in your care, which is the way it should be. But of course, once you're discharged and you're back out into the community, it's a where do I go then kind of feeling.
When people go home, the enormity of what's actually happened to them is quite overwhelming. And we often warn people, when you walk into your front door, into the comfort of your own home, don't be surprised if you feel like your world's caving in, because it suddenly will. The cancer diagnosis will hit much, much harder.
You feel quite lonely, and I felt a bit guilty on my family as well, because they've obviously got the worry as well. I'm normally there as the strong one in the family that, you know, sort everybody out, and obviously at that time I just couldn't deal with anything.
It can be a time of feeling at sea, not really feeling supported. Some people describe it as feeling abandoned because you're at home and life carries on, but that can be very difficult and an isolating experience for some people.
It's not something you can easily talk about to people, because you can tell people don't want to know when it comes to the word cancer.
Prior to me getting or understanding I had cancer, unfortunately, my father had died. He died of a carcinoma. He had bowel cancer. So I'd lived through it with him. I was aware of all the ins and outs of what bowel cancer was and how he didn't manage it really very well. He didn't have any support from the hospital, I felt, and I don't think the doctor was able to help him either. He tended to just try and get on with it, but his life was controlled by the fact he had cancer, not controlling the cancer himself.
I think some people have the attitude that if they don't talk about it, it doesn't exist. It's not going to affect them. In actual fact, it does. It happens to everyday people. Anybody can get cancer at the end of the day.
The idea of the CREW study came from some research that we did several years ago involving cancer patients and people affected by cancer across the UK, when we asked them what was important to them in the sorts of research that we should be doing as a research group and more generally. And the priority for them was for us to start thinking about the impact of cancer on everyday life.
So we're following 1,000 patients who've had colorectal cancer, and what we're looking really importantly is about their health and well-being.
In the past, a lot of research has focused on symptoms, the consequences of surgical intervention, and the physical effects of having that treatment. But this is very much looking at the emotional impact and the lifestyle impact of having cancer, and particularly colorectal cancer.
We're working with 30 cancer centres from all over Great Britain. So we're working with 30 cancer nurses in those hospitals who are recruiting patients locally. It's really important that we follow people over time, so the survey comes back to them at a number of time points, so that we can look at how things change.
At the time when you're asked to do it, you know, you're going through a lot of lows and you're feeling a bit depressed, but at the end of it you just think, well, if I can help somebody, then, you know, for the sake of ticking a few boxes, then I'll do that.
This isn't necessarily from a medical perspective. This isn't asking about blood results or how often she goes to the toilet, for example, anything like that. This is literally asking how she's feeling emotionally, whether she's going out with her friends as much as she used to, how she's functioning within her family, how she's functioning even financially, if there's any help that she needs with that. And it just is a measure of how she's getting on with her everyday life and whether or not she's getting back to normal.
You know, there's always going to be patients with bowel cancer and other cancers, so I hope it does help. And that's the reason solely why I agreed to do it.
Because of my father's experience of how he dealt with the cancer, when I first heard about CREW, I decided that I wanted to actually take part in the study because I felt I had something to give. I'd already decided how I was going to cope with my cancer, but I felt that other people might learn from how my strategies for dealing with it were. Because my father had nothing, he had no strategies, he had nothing in place to help him, and I just wanted to give something back.
Susan responded incredibly well. She obviously understood from the outset the benefits of undertaking the survey, not just for her, but for people in the future in terms of shaping the way we can deliver care for people like her.
I decided as soon as I'd been diagnosed that my life would continue. I didn't want to lose anything that I'd been doing because I probably didn't at that time know if it was going to be the end. But I felt that I needed to carry on my life, and I love dancing. It makes me laugh. I perhaps don't take it as seriously as some people. Some people might liken me to Anne Widdecombe when I dance, and I would think I'm like Alicia Dixon, but you know, I'm probably in between.
She hasn't let it deter her life, she hasn't let it interrupt her life, and she's been through a succession of, she's had surgery, she's had chemotherapy, she's had further surgery, and if anything, it's made her jump up and grab life in a better way than she did before, and she's very much a larger-than-life person in the first place.
I think answering those questions really helped me understand not just what I might be feeling, but other people might be feeling as well, so I could perhaps support some other people.
Every time I speak to someone, I'm reminded of how important this research is, because if we don't ask these questions, we're not going to be able to, they're out there on their own and we're not going to be able to support them. And yeah, it's the fact that actually there's 1,000 real people out there who are taking the time out to help us so that we can help people in the future. And that's really wonderful.
I would love to see from the CREW study that the evidence that we gather and the reports we have from patients informs how to prepare future patients for life after their cancer treatment.
And I think that research gives people a voice, it gives people the opportunity to say how they're feeling, to say what they want, and to be part of something that's ever-changing, which is the NHS and the healthcare provided.
By taking part in the study, I do feel that, you know, they are listening to patients. I'm quite sure that by doing this, they'll provide a better service and be there to help people.
If there's one thing I hope that my involvement in the survey has put a message across, is the fact that I don't want to be wrapped in cotton wool. You know, there are things going on with my body, it's not very pleasant sometimes, but I want to get on, I want to have a life, I want to enjoy the life. And it's me, the person who's controlling the cancer, and not the cancer controlling me.